Thank you again for participating. This is our seventh consecutive year of putting on this Health Philanthropy Summit. We are thrilled to do it again. So we're living in a VUCA world. What does this mean? And what does it mean for us as fundraisers? We live in a world that's constantly changing, becoming more unstable each day, where changes big and small are becoming more unpredictable. That's volatility. It's becoming more difficult to anticipate events or predict how they'll unfold. Historical forecasts and past experiences are losing their relevance. That's uncertainty. Our modern world is more complex than ever. Decisions can be reduced to a tangled mess of reaction and counter-reaction, and choosing a single correct path is sometimes impossible. That's complexity. And one size fits all, or best practice, well, those have been relegated to yesterday. Not everything is black and white. Gray sometimes is the only option. That's ambiguity. As fundraisers in health organizations, we need to understand what this means to our donors, to our colleagues, and to our organizations. We need to become part of the solution versus part of the complex problems. We can change the world. We need to help our donors and prospects with the VUCA situation, to collaborate with them to navigate themselves through this difficult or different world. We need to change our mode of operation. We need to equip our organizations and our people to deal with this unfamiliar environment so they can respond in ways that are appropriate to the situation. We need to start by taking our eyes off of ourselves and off of our donor offerings, our naming opportunities, our event sponsorships, our annual funds, and our events. And we need to genuinely focus on the donor and what they're trying to achieve. We can't go in with a preconceived proposal or agenda so that we can get what we want. If we do this, we add to the prospective donor's VUCA, and we're not adding value. Major gift officers, fundraisers in healthcare can change the world. Think about that. The world is volatile. The healthcare world is volatile. It's unstable and uncertain. Big organizations and systems are changing. Small community hospitals and critical access hospitals are changing. They're struggling with issues and things that are changing faster and faster and faster. That's a difficult environment for a healthcare gift officer to change the world. But we can change the world. We need to have a different mindset to deal with this unfamiliar environment. As you heard from Jennifer, VUCA stands for volatile, uncertainty, complexity, and ambiguous. But it can also stand for vision, understanding, clarity, and agility. If you think about it, we're all operating in that environment. Our major gift donors and prospects are dealing with more volatility, more uncertainty, more complexity, and more ambiguousness than ever before. It's exhilarating, isn't it? It's an environment that we can thrive in. So what are we going to do? Are we going to add to that by simply going in and trying to use our typical fundraising techniques to get donations? I hope not. We need to be challengers, to be visionaries, to be prophets. If we're going to help our organizations and our donors and our prospective donors to navigate through this environment, we need to speak of a better time, a brighter vision for the future. So the question is how? How do we need to be more? How do we need to change? It starts with taking our eyes off of ourselves and our organizations and a focus on our donors and prospects and what they're trying to achieve genuinely. What are they trying to achieve with their philanthropy, with their legacy, and with their blessings? Genuinely focusing on the donor and their values, and to help them navigate the complexities that they're dealing with. We're in a VUCA era. We need to be creative, imaginative, and think of new ways to be able to find solutions and opportunities to deal with our complex problems of today and the complexity of healthcare and philanthropy and beyond. We need to provide understanding. We need to help it become less complex, help philanthropy become less uncertain. That's our role. We can't go in with a preconceived proposal or a solution so that we can get what we want. The whole focus of our being is to give to our donors. Focus on them and understanding what their issues and challenges are. We provide clarity. We make things clearer, more simple. We don't want our donors or prospects and clients to question our motives and to question our agendas. On top of everything else that they're dealing with, we need to be clear. Clarity and honesty. That's the starting point of a relationship. In today's time, we need vision, understanding, and clarity. We also need agility. Agility is stepping away from the traditional approach, being innovative, and replacing old work habits. Because of the rapid and constant change in today's world, fundraising leaders need to become more agile to adapt quickly to external and internal changes. We need to be flexible to our donors and our prospects' motivations and sometimes their demands. Again, in today's VUCA world, we can change this world. We've got to really believe that we can change the world for the better. So how do we do that? How? Well, we need to set goals. We need to give our fundraising a direction by creating and setting ambitious goals. We need to be flexible and innovative. We need to identify the barriers that prevent us from hitting our targets, but we need to change our strategies if there is a need to, and manage our goals, making our goals manageable, making them more realistic and achievable. We need to stay focused, always finding our center, taking a step back if we must, and staying balanced in today's world where sometimes the only way we can communicate is through a video conference or a Zoom. We need to be committed to our tasks. Block out a specific time in a day or a week to work on our tasks. We need to practice patience and acceptance. We can encounter many challenges along the way. Most things have unknowns, but once you start working on them, the unknowns become known. Be patient. You do not need to rush into a gift at the expense of seeing some other outcome, positive or negative. Trust the time and the process. And be trusted. To build healthy relationships with other people, you need to be someone whom they can trust. Communicate and collaborate. Share ideas, curiosity, and creativity. Trust and learn. Agility is innovation and openness to new information and new ideas. Be encouraged to think outside of the box. Finally, I'll end with a quote from Bill Gates. He once said, "Success today requires the agility and drive to constantly rethink, reinvigorate, react, and reinvent." Thank you again for your participation today. Thank you for joining us. And thank you to Ohio AHP for partnering with us again for this, our 7th consecutive year of hosting this summit. And thanks to my colleague Jennifer Wood, who worked so hard to put this summit together today. We at Health Giving are proud to be partners with you in creating healthy philanthropic results that are helping our communities and your community be happier and healthy. Onward and upward. Thank you.